to. So, hi, this is Dr. Yoon Han Kim. I'm a integrative and functional medicine physician, and I'm an LDN expert. And twice a week on Fridays, 6:30 p.m., which is for Australia and Asia, that would be about 11:30 a.m. The next day, so Saturday. And I have a sec. This is the second session, which is on Saturdays, 10:30 a.m. in Central Standard Time, which corresponds to about 4:30 p.m. In UK, or at least in GMT, Greenwich Mean Time. So if you could let me know where you are, I would be very, very curious. Is anyone actually in UK? So you can unmute your mic or you can type it in. Italy, wonderful. I think Alessio and I have exchanged messages. I think so. Alessio, if you have questions, you can unmute yourself and ask me.
Yeah, thank you. Thank you, doctor. Yes, I have a question. First, I want to thank you for all this work that you do for us.
It's my pleasure.
My,
And thank you for being here.
thank you. My question is, what is the stability of naltrexone at temperatures below 0 Celsius? I ask because mine was accidentally left in the freezer overnight. I have a liquid, and I'm not sure if it is still effective.
Um,
My
let me
pharmacist mentioned it's likely fine, but couldn't be certain as there are no specific studies available.
let's see. And yours is in water, right?
Yeah, it's a liquid form. Yes, not water. It's compounded in a liquid
But the
version.
base is water, right?
I don't know. It's like a more like a gel.
Oh, it's like a gel. It should be no
Yeah.
problem, I think.
Okay.
Naltrexone, chemical stability.
Yeah.
So let's see what stability of naltrexone would be. Chemically quite stable under neutral conditions and solid and liquid formulations, but basically the issue is more acidic basic stress, elevated temperature more than cold temperatures, exposure to UV light. So if you're protecting it from pH, heat and light is okay. I think that usually I tell patients if they are not done with LDN or the dose is too high, just put it in the refrigerator and
Okay.
you use it later. The liquid ones, I think I've heard most pharmacists tell me that in 30 days, but I've recently heard from our member that the pharmacist told that person that as stable as 3 months. So um, I think it's pretty stable. I would say that I haven't heard, but it looks like yeah, photo acid base and heat shock, and um, but they say that the dry heat exposure produces detectable but less degradation than acid or base or so not living in the like leaving it outside in the bright sun would be the worst. I think winter with freezer is winter, and I think no problem. But and I'm glad you asked your pharmacist. That's really smart of you. So where are you in Italy, Alicio?
Bologna, the
Bologna.
city of tortellini.
I love to learn where people are. Um,
It's in the center north of Italy.
my father worked for an Italian company, but the name is called SGS, and then later they joined the French, so the Thomson, and as you are probably already aware that a lot of the industrial might of Italy is in the north. So, and the actual factory or the corporate was just outside Geneva. So my parents went to Milan quite often. And where you are, I think is south of, it's in between.
Bologna.
Yeah, like Florence is not far, Ravenna is not that far,
Yeah.
but there's a road I think called, you call it E35, E34, that
Yes,
connects to Milan.
exactly, exactly.
Yeah. So, any other questions?
I have a question,
Yes,
Diana.
Diana.
Um, I
Diana,
have,
where are you from?
I'm from Medicine Hat, Alberta, Canada.
Fantastic. How come I heard that name, Medicine Hat, Canada? Is it
Um,
Alberta?
yeah, it's in Alberta. It's it's a nice name, Medicine Hat.
It's a lovely name. It really is a lovely name. But I do know that Alberta has real winters, and so you're not far from.
Yes,
I mean, not far probably means like an hour, 2 hour drive to Calgary.
about 2.5 hours to
Yeah,
Calgary.
and maybe 4 to Regina.
Red Deer
Yeah.
is about 4, and Edmonton is about 6.5,
Oh my God, I have my
7.
wife has a cousin living there in Edmonton,
Oh,
but I think it's real of like, we consider Minnesota to be Arctic, but you are north of Arctic by at least 8 hours, I think. Winnipeg's not warm either. I think the only place
Winnipeg.
that's the warm
Yeah.
is Toronto and Vancouver.
I'm actually from Toronto. I moved to Medicine Hat, but
Mhm.
yes.
So what's
Um,
your question today?
oh, okay. I have two conditions, peripheral neuropathy and interstitial cystitis. Um, I,
Didn't we talk? I mean, didn't we chat on the school or Facebook? I remember these two
yes,
combinations.
yes. Um, I, I'm confused at this. I'm a moderate responder, so uh, I understand about starting at 10 micrograms and increasing every 2 to 4 weeks. Um, and um, I'm, but with peripheral neuropathy, um, it, you usually need a higher dose, like starting at 0.5 milligrams uh, daily for 14 days and increasing zero point 0.5 to 1 milligram every 2 weeks, up to about 4.5 milligrams. So I hope I'm giving you an adequate question here,
Oh, I
Dr.
think this
Kim.
is a really great question.
Okay.
So the question has to do with peripheral neuropathy dose being high. And Diana, I appreciate it because I think you have seen and read my post previously before, so you know that how I treat neuropathy is higher dose than I
Yes.
see. So another thing I tell people share with my patients in my practice is that to engage with one dragon at a time. Dragon in Chinese medicine, dragon is a word that we use for a condition. So and you can kind of imagine, if you have a dragon that you have to live with, you don't want to make dragon angry because it's going to breathe fire on you. So in this case, what I would say is that you have to engage with the probably the IC, interstitial cystitis, before you can engage with the peripheral neuropathy.
Oh,
Um,
thank you. Because that's the most painful condition I'm
exactly,
going through right now.
exactly.
It's the
So
most severe.
that's what I would say is that it makes sense to target the more. So, if you have two dragons, one dragon is more tolerant and the other dragon is non-tolerant. Um, I think that you have to target the less tolerant of the dragon that causes more difficulties for you. So, um, and I think it's a not easy because it's always being used, and I think that there are food issues that you got to work out. It's I would say it's one that you would benefit working with a someone who really knows both interstitial cystitis as well as LDN. Because, and I've had patients with IC that have gotten fantastic results, but and then you probably heard me talk that I have, I have had, I always say 30% of about one third of the patients get fantastic results. It's like magic for them, and then the other one third we have to work hard for them, and then the other third not much of a responder. So I think that there's been two trials looking at IC, and it's called the IC pain trial, and randomized placebo-controlled using 2 milligrams nightly for 2 weeks, and then 4 milligrams nightly for 4 weeks. Kind of similar to what we're talking about, except their dose is a lot higher. But this is already better because a long time ago, everyone started research at 4.5 milligrams. So, and um, the it's an ongoing study, so it's not published. The other one is a LDN for bladder pain syndrome at Stanford, 8-week trial measuring challenges in pain inventory, voiding diary, bladder pain, and IC symptom score. So I think that it makes sense to, they say 2 milligrams, 4 milligrams. I think that it's ambitious. I think this is for people who are highly functional. And if you think about it, people who can fun attend trial, I mean, there's other extra things you have to do. And if you started in your dosing at 10 microgram, that means using my scale, that means 2 out of 3 questions you said yes to. So I think that that's a good approach. And some people can double, like 10 to 20, 20 to 30, 30 to 4, and then readjust the dose. Um, or some people can't even do that. So they go like 10%, 5% of the dose. So there'll be 1 microgram, 2 microgram going up at a time. You have to work with yourself. I mean, if you go to other LDN sites, they always say, what is the magic dose? It's like, there's no magic dose. There is the sweet spot dose for you. And just like you didn't come with a manual, right? Like, you don't have a manual for your husband. You don't, she does not have a manual on you. LDN, it doesn't come with a manual. So I think that your approach, actually, I quite agree with your approach, is engage the dragon that is giving you the most amount of difficulties. And then, the neuropathy, there are other things you can do. But the one of the things hard about, I think, the IC is that everything that goes into your body is going to come out either way, right? Urine or feces. So if you take things that are difficult, I think that it just, there's more chances of making it angry. And if you make it angry, I don't think you it's very difficult. And people who have not had bladder pain don't understand the level of torture, because going to bathroom, you're almost like afraid, right? When it acts up, Diana,
Yes.
because you know how it's like somebody put fire down there, so it's not really happy feeling. So some people, I think that so that is the idea. And but I do think that using a general functional medicine approach with what you have, I think, is a good idea. um, and if I get around to it, what I'll do is a functional approach to uh, interstitial cystitis, and using LDN.
Thank you.
Yeah, and the this is my uh, blog, and it's ifmsynergy.com, and you can just sign up. It's free, and put your email, and then sign up, and then you have to go to email to confirm you sign up, because they're afraid some people might just sign you up involuntarily, and they don't like that, which is good.
That's IFM
No,
Synergy.
I wrote it down here in the chat. IFM, like that
Oh,
stands for
I,
integrative functional medicine synergy.com.
I don't s yeah, I'm not very good with the computer. I don't see it in the chat.
No problem.
Oh, I mean,
I can
later
just
on, you'll have it?
yeah, I can actually go to school. It's right here, and then I can just look for you. Um, Diana, are you in the school community? Oh, you
Yes.
may not be in the school community. So, are you joining us from do you know me from Facebook?
Uh, yes, and I
Would
go to school, the school site, because it's much freer.
yeah. So let me just put it. I'll just write it here. This is for Diana. For Diana, my blog address, and I'll just put it on right. That's not it. Uh, IFM synergy. So that's been done, and then but yeah, I think that it to me it makes sense to do it. Are you taking medication for IC like
Um,
Pentosan?
no,
Okay.
um, I am taking Tylenol 3s for the bladder pain.
Oh my God.
Um,
So how do you take LDN if you're taking
uh,
um
I'm I'm not prescribed it yet. Medicine hat doctors, there's been 5 of them turned down LDN prescribing them because they say they don't know how. And so I'm waiting April 2nd to see my general practitioner
so
because my
I'll give you a
uro
paper. I'll
yes,
give you a paper that you can take it to them. If you're taking opioid, you have to start with one microgram. That's the best way, and you take it whenever you take the opioid. And you when you run out of that, then you can use the higher dose. That's what I tell people to do in my practice. So since you can't see it, I'll just put it on. Um, it'll be for Diana blog address, and then I'll put it here. Article for using LDN for pain, including opioid, opioid. That so, and that way this is for you. Okay, Diana.
okay, thank you very
Yeah. So
much.
you do have access to the school, right?
Yes,
Okay. You know what? Post something so that people can say they like it, and then if in school, if you see any post, go ahead and like it because that gives that person a point because they operate in point system, and the more point you have, the more things that you can do. Because if the point is too low, then you can't even chat, and that's a little silly of the system, but I think it's not that difficult to do. So if you see someone posting, go ahead and like it. You don't have to read it, just like it, um, so that other people will gain points and get to do more. And so that's what I do when I go to. I don't necessarily read everything, but I just go ahead and like what I see everything. But we're already like over 300 people in members, which is really great. Because if you think about the Facebook, even we have 9,000 plus, or we are reaching 9,000, but probably 10%, 900, and probably 10% of that are really active. That means less than 100 people are truly active at one time, and we already have 300 here. So I think it's going very well, and I'm very grateful to everyone. Diana,
that,
more questions for you from you?
uh, just I didn't take a cystoscope. I didn't get diagnosed with interstitial cystitis. I belong to a support group, and from that I deduced that I have it. I'm afraid to go under cystoscope, but I don't want to take all the time here. So,
Okay.
uh,
Yeah. I think one of the issues that I see in groups is that sometimes it will delay the diagnosis. And I don't know how things work in Canada. I think that if you think that it is, and you find a way to find a way to live with it, I think that's one thing. But if the correct diagnosis, I think is useful at times. So I do think that it's worth it. But you will have to decide what is worth it, what is not worth it. So that's
Okay.
all. Yeah. Is there any other questions? Do you want to type it? Do you want to?
No, I don't know how. I just have a screen, so
It's okay. You have
I'm
the white screen because I have two screens. One is a just white screen, and then the other one is the other screen shows everyone what they're doing. So I know what you're talking about. It's the white screen
yeah.
that you. So when you go out, there will be some posts that I did for you, and in the comment section, there's a link, and you can download the article, and you can print it and give it to your doctor, and ask them to prescribe you 1 microgram of naltrexone, or get whatever you can, and then learn how to dilute it.
Okay, thank you.
Yeah, I'm sorry. It's what you have is really not very easy.
No.
So I'll write up something, and then I will put it in our what do you call that thing? Um, I'll put it up in our site.
Okay. Thank you so much for your
Yeah,
time.
it's not easy. It's really not easy. So all right. So any other questions? We're 8 minutes to go. If you have any questions, either you can unmute, or you can just type the questions, and then we'll go from there. If you no questions, then I will go ahead and review with you guys what we talked about yesterday.
I have a question.
Yes, sir.
Okay.
Alicio.
Just for context, I have fibromyalgia and small
Mhm.
fiber neuropathy already diagnosed, but I suspect I also have chronic fatigue syndrome because I
Excellent.
experience very severe fatigue weakness,
Yeah.
but this
So
hasn't been officially diagnosed.
it doesn't really need to be, but here is. Are you able to see the chat?
Yeah, yeah.
Okay, excellent. So let me find, because I wrote about that.
Oh, your blog, I read all your posts already.
Yeah. So the
Yeah.
idea, and the thing is that I've been practicing medicine for about 13 years in doing this, and I've just seen so many times that people start with fibromyalgia, and then they will progress onto chronic fatigue syndrome. And chronic fatigues. Actually, if they start like that, the treatment for me is very easy. But if people just have chronic fatigue syndrome and then they have fibromyalgia secondary, they're harder because there's primary source. Why? So chronic fatigue syndrome or myalgic encephalitis, they like to say also, is this that you have to look at multiple areas where you can that can cause it, and chronic pain being one of them. But like I said, those are easier. The harder part actually is the sleep. You have to look at their sleep. If they're not sleeping, of course they're going to be tired. But the thing is that if you have fibromyalgia, people with fibromyalgia will get worse quality of sleep. What that means is that they're not sleeping deep enough. They're having more interruptions than other people, and LDN can help with this if it works. And um, if the LDN can help with that, and then LDN itself can also deepen the sleep and whatnot. And so having LDN correct several things is helpful, but because chronic fatigue syndrome has so many, like it can be hormone issue, cortisol issue, it can be hidden infection issue, it can be nutrition issue, and autoimmune and endocrine issue. So that means that it's quite a big workup, even in my practice. And when people come into fatigue, I have to educate them that I can't fix it. It's not like one time consultation and they get better. Now I required them membership for 3 months for everyone, because I think that otherwise it doesn't make sense. And otherwise I'm always tinkering with membership and membership, start and membership. So now I just ask them to come into 3 months, because 3 months actually is not enough time. But if people are not willing to look at the different hypotheses, the shine protocol, I just don't accept them, because it's like um, asking me to go fight for them, and then they tie my arms, and it does, it's really not very nice. So this is the article I have on Shine. You probably read this one too. Understanding CFS, ME diagnosis, the Shine approach, the promise of LDN. So the LDN, I think, is helpful for both. The fibromyalgia, there's type that is autoimmune is involved. LDN works better for that. LDN, I haven't found LDN to be as helpful for pure fibromyalgia. Which type do you think you have? Do you think
I
you have inflammatory?
I think because I did some, I mean, medical examination, I have Th1 hyperactivation, so my T8 lymphocytes are very active, and very the number is very high, and the natural killer. So it seems like mine is not yet autoimmune, but it's more like hyperactivation of the immune system. I
Yeah,
also have Epstein-Barr and mono and cytomegalovirus, very high number
yeah,
of. So I think mine is that. Mine is
yeah,
this kind of.
yeah. So there are studies now that show that people with certain types of viruses with high titer, th- it puts them at risk for having how do I say this? Like lupus and other autoimmune conditions. So I think you're talking about the Th1 dominant immune phenotype
Yeah,
skewing
yeah,
of CD4 T helper cell response towards Th cytokines. That's IFN gamma, IL-2, and tumor necrosis factor
yes.
alpha and beta, and then suppression of Th2, Th17, and that just, I think that, LDN modulates Th1, Th2 balance, but I wouldn't say that it is the only thing. But I know that LDN can be helpful for T1 dominant type 1 diabetes. LDN can be helpful for T1 T17 driven rheumatoid arthritis. It can be helpful for T1 and Th17 multiple sclerosis, and T1 based signature Parkinson's disease. But I think it's important to say that LDN, we're just beginning to understand about LDN. We're still very far away, and that's why I think the groups like this is super helpful to discuss. But I don't know everything about LDN. I'm learning about it every day. I mean, people say, "Why do you do these things?" Well, because it helps me to learn. It helps me to learn, and I want to know every aspect of LDN, because it can be so helpful. And imagine all the people who are put by general doctors 1.5 milligram or 0.5 milligram, and they can't tolerate it, and oh, it's not for you. And I feel like that's such a mess. So yeah. So Thana, thank you for writing. Hashimoto's taking LDN, very sensitive, up to 1.5, but need to go down. So I think if you're good at 1.5, I would restart at 1. The reason is that if you're endorphin depleted, or stop for, this is what I tell my patients: stop for 7 days and go to the lower dose. So we have 1 more minute, and I want to wish everyone um, happy rest of the Saturday. Oh, Thana, you didn't tell me where you are. Where are you? Are you in UK or are you in the US? I know you're not in Asia because it's like 1 o'clock. Oklahoma. Oh, I think, weren't you on before also? I think I remember that someone was on from Oklahoma, and I remember the picture, the happy picture of a couple. So yeah, Oklahoma is a great place. So I'm going to sign off. Thank you so much for joining me, and I'm going to continue to do this until no one shows up, or more people show up. Or I think this is a lovely number. Then we can have a very better communication conversation. So thank you, everyone. Have a great weekend.
Thank you.